diagnosis of Parkinson's. So patients typically have tremor in 75% of cases, as we'll talk about in a second, and bradykinesia. If they have both of those and they respond to medication, you're pretty sure they have Parkinson's. As I mentioned, tremor is pretty common in folks. Up to 75% of patients have the tremor. It's usually at rest in one hand or the other, and it may occur in the hand, the arm, the foot, leg, chin, lips, or tongue. Lots of different parts of the body. Classically, if someone has a resting foot tremor, you certainly worry about Parkinson's in folks that have leg tremors or foot tremors. That's one of the most common diagnoses in folks with tremors of the legs. It typically improves when they move the affected limb. So as they extend their arms out in front of them in the office, it should go away for a second, and then it may reemerge and they'll have a tremor again, okay, after they put their hand out for a while. It does increase with stress and anxiety, as many medical problems do. It can make tremors worse, it can make Parkinsonism worse, etc. So if you have a stressed out Parky patient, it certainly can look bad on certain days. Well, how do you tell essential tremor, like Katharine Hepburn had, versus Parkinson's disease tremor? Well, first of all, you can look at the location. The head, the hands, and the voice are typically affected in ET. So you may remember Katharine Hepburn on Golden Pond and other movies. Hello, Henry, with her shaky voice. Okay, that's very typical of essential tremor and not typical of Parkinson's disease. Also, the head may shake in a no-no or a yes-yes fashion. And head tremor is more common in ET, much more common in ET than Parkinson's. Now, if someone has a tongue tremor or a lip tremor and it just started and they haven't had long-standing essential tremor, you certainly think of Parkinson's in those folks. And I mentioned leg tremor as well as classic for Parkinson's. Most folks with ET don't have slowing of their movements beyond aging. But in Parkinson's, you have the rigidity and the slowness, the bradykinesia, as a part of their features. Many years is a typical duration of ET. So it runs in the family commonly as an autosomal dominant condition, and they've had tremor, let's say, starting in their 30s or 40s, and then it gets worse gradually over time. And if someone comes into your office saying, yep, I've had Parkinson's disease for 30 years, you automatically doubt the diagnosis. One reason is that Parkinson's shortens your lifespan still. Another reason is that ET has this long disease duration. But PD folks, they typically live about 15 to 20 years after diagnosis. Family history, as I mentioned, is very common in ET patients, autosomal dominant pattern of inheritance usually, but less common in Parkinson's. If someone's lifetime risk on the average without a family history of Parkinson's is maybe 1 to 1.5%, let's say, it may be about 2 or 3% in patients with a family history of Parkinson's and a first-degree relative. Folks that have essential tremor frequently know that drinking alcohol, like a beer or a glass of wine, will help the tremor a good bit. And the tremor with ET is typically when they do things. So their handwriting is shaky or tremulous. They shake when they put their hands out. They shake when they're trying to eat with a fork or drink with a cup. That's classic of ET. Folks with Parkinson's, however, have more of a resting tremor with the arm fully supported, much greater than postural or action tremors. Levodopa, or carbidopa-levodopa, also known as the brand name Sinemet, is really effective for folks with Parkinson's, but doesn't do much for patients with ET at all. Beta blockers and alcohol and primidone, the antiepileptic, actually help the most with folks with essential tremor. And I described the handwriting sample that you see there for folks that have ET as chicken scratch. It's decent in size usually, but very illegible and hard to see sometimes. Folks that have Parkinson's, however, have an associated finding called micrographia, small graphia handwriting. So you can see there that you can barely read "Today is a sunny day in California" on the slide because it gets smaller and smaller and it tails off. So those are the differences between ET and PD overall. Other signs and symptoms of Parkinson's include, as I mentioned, the small handwriting, the micrographia, lack of arm swing. That can be a first sign in many folks. Actually, orthopedists have gotten to numerous patients and labeled them as having frozen shoulders. Maybe they do have a frozen shoulder, but commonly, many of the patients just had the onset of Parkinson's disease and the left arm's not swinging. So you'll see that as a mislabel, and especially if they have tremor in that arm, you certainly should be suspicious of Parkinson's disease. Hypomimia, or this masked face that patients with Parkinson's get, is very common. Hypophonia, soft voice, is typical of Parkinson's, where it gets hoarse or raspy. Depression can also be an early feature of Parkinson's disease and even a harbinger of Parkinson's to come in some folks of the right age. Anxiety is also very common in early disease. Lack of sense of smell, that's a very interesting one, and probably constipation and that lack of sense of smell can be one of the first signs of Parkinson's even before the motor symptoms begin, even before the tremor and the rigidity and the other features. So if you know someone who's an older person that has lost their sense of smell or has significant constipation on top of that, certainly you'd be suspicious that they're going to develop Parkinson's at some point in the future. Studies have shown that that combination may be a harbinger of Parkinson's. Also, folks with Alzheimer's lose their sense of smell, so that's another condition to be thinking of. Well, Parkinson's is slowly progressive, just like ET, essential tremor, and it's a nervous system disorder where you lose dopamine neurons. So that's the main chemical that is responsible for the motor symptoms of Parkinson's is lack of dopamine. And actually, folks, by the time they come into your office with a right-hand resting tremor, have already lost half of their dopaminergic neurons in their substantia nigra, and maybe 70% of the dopamine, so meaning that the cells that are still left may not be making as much dopamine as they should be compared to controls. The classic pathological hallmark of Parkinson's disease is indicated there in the lower right-hand picture. You can see the eosinophilic or reddish-colored inclusion inside that nerve cell there. The nucleus is kind of speckled and dark, but the reddish-colored inclusion with the halo around it of clearing is called a Lewy body. And patients with Parkinson's have these in their substantia nigra and other parts of the brain as the disease advances. It may be a good thing. It may be a wastebasket and not actually something that kills the cell. So we're still discovering exactly what it's made of, why it's there, and is it toxic or is it protective. As I mentioned, dopamine is lost in the brain of patients, and you can see that over time in some functional scans that we can do. One is called fluorodopa PET, and you can see at the baseline there on the left-hand side picture that there's a lot of red splotches there in the basal ganglia and the caudate and the putamen area of the brain. On the right-hand side, 2 years later, you can see the same patient scanned, and there's been loss of that red signal somewhat in the tail of the putamen there in the bottom of the comma in each of those. That happens over time. So it's progressive disease. Folks are have lost a lot of dopamine when they present, and they continue to lose it throughout the disease. However, Parkinson's is much more than just loss of dopamine. Folks have also lost significant amounts of acetylcholine in the brain, and research has shown that in advanced PD patients, the loss of acetylcholine is greater than the loss of acetylcholine in Alzheimer's. And again, we commonly use drugs to replace acetylcholine in Alzheimer's patients. Well, what are the causes of Parkinson's? The bottom line is we still don't know the exact cause. We know the pathology. Unlike essential tremor, if I slice the brains of ET patients and look for a certain pathology, I wouldn't find them. Folks with ET commonly have no pathology that's identifiable in the brain. It may be a physiological or biochemical type issue. But patients with Parkinson's have lost these dopamine neurons in the substantia nigra, as well as other neurons in other parts of the brain. But genes plus environment probably combine to create risk for Parkinson's disease. And not just one gene. Very rarely does someone have a single genetic defect that makes them have Parkinson's or Parkinson's-like disease. And there are a few there that are listed that are quite rare. Parkin is probably the only one that's commercially available, if I know right now. And Parkin is not worth testing for unless someone is really, really young, like 30 or 25, and has signs of classic Parkinson's-type disease. And it's autosomal recessive and really rare. The others are not even worth testing for, and it's probably a combination of genes that put you at risk for this. Pesticides, rural living are also associated with risk. Well waters is a risk, possibly because well water may contain bacteria that have an inhibitor of the protein breakdown machinery in the body called the proteasome. That's one theory. We're not so sure that's true yet. But folks that have been exposed to well waters for a long time are at higher risk. All of these mechanisms that you see there in the middle are common to most neurodegenerative diseases like Alzheimer's, Parkinson's, etc.